Good afternoon. I'm Terry Scoggin, the CEO of Titus Regional Medical Center here in Mount Pleasant, Texas. Today's Friday, August 27th, 2021, and it's time for our weekly update. I want to start this week and show you a little slide when my clicker works. In a second, the slide will come up. But I want to just talk a little bit about heroes here at Titus. And, you know, we talk about our nurses, we talk about our labs, we talk about everything everyone's doing. I want to give a shout out to a couple other departments that don't get a lot of shout out all the times, and that's our EVS, our cleaning teams, and our nutritional services teams. I will tell you, with all this going on and every life and death on a daily basis, these two teams have gone above and beyond for our community. This is Zion. Zion works in our emergency department, and over the last few weeks, as the emergency department has just been crazy. I've gotten text after text after text from my nurses just thanking me to shout out to him for the little notes he got. He walks around and he puts little sticky notes and just says to different people that they're doing an amazing job. Earlier this week, we had a couple traumas come in, not COVID related, and it was crazy. And the front and the back were both just swamped. And the person doing the screening was just overwhelmed. And she got a little note from Zion, just said, thank you for the amazing job you're doing. And it touched her. And I just wanted to give a shout out to him. And I also want to shout out to our nutritional team. You know, on a daily basis, they're doing little things like this just to make not only the patients feel special, their families feel special, but also us as team members. So a shout out for both those teams and just want to thank them for being heroes in healthcare. And you know what? They're saving lives as well. From a numbers perspective, it's the fourth surge, and we're continuing, and not much change, but just give you a high-level piece. But, you know, you can see our numbers are sitting in that 200, 195 range. ICU beds about the same, and the reason why the ICU beds are the same is no place to put them. A lot of the hospitals around us are putting up tents in their front yards to help put additional patients, or going on divert. And we're getting a lot of those here. And people are sitting in our emergency department. This week we had, at one time, 8 holding early this week. Today, we're sitting 19 patients in the hospital with COVID. 10 on the floor, 5 in ICU, and 4 holding in the ER as a few hours this morning. We did open last week the urgent care to help with our emergency department, and we converted a part of the hospital to help. And we saw anywhere from 18 to 29 patients on a daily basis. So everything we're doing is helping, but we're still considerably strapped and capped for amount of staff. So I will encourage you to help us, and vaccination is probably the key right now to helping it. I've seen nothing but different things from around the state that everybody's in the same boat that we are. You can see from a Tyler perspective. I know I talked to Christus and Jason a few days ago, and they were sitting at 170 in the Tyler Hospital. You can see 728, and they just go up every day in there. One of the things that we're continuing to do to keep people out of the hospital is Regeneron treatments. It's an outpatient. The state is setting up infusion centers. I'm very proud of our medical staff, our doctors, and our nursing and clinical team for the work they've done on Regeneron. Dr. Thurman, Kathy Griffiths, and a lot of other players have been involved from day one. We've been giving Regeneron for months now, and we gave it during the last surge, but we've really been focused this fourth surge to keep those people out of the hospital, and it's worked. Our numbers have been down in the hospital because we're getting this treatment. An article was done by the newspaper in Austin last week that went by this and talked about Dr. Thurman, and we've received a lot of questions this week and a lot of people reaching out. You can see our Regeneron numbers came up all week. Yesterday, I want to give a shout out to our EMS team who went to one of our local nursing homes to give 10 patients Regeneron because they all contracted COVID this week. We were very concerned. So we were able to help 10 people. You know what? I know they saved some lives. I know they saved one of those people's lives who got that treatment. So we're continuing to give it. I will encourage you and check our website and Facebook post. We're going to put out the information. The state is starting to have limits on how much Regeneron you can get because the inventory is going down. So we're going to have to be very meticulous of how we give it. You need to go through your primary care physician. So I would encourage you to contact your doctor, get your order, and your doctor can help get you that Regeneron treatment if you qualify for it. We're going to put on our website later tonight and early Monday morning links to the state's infusion centers. There's one in Nacogdoches and Fort Worth, and there's a hotline number. If you're seeing this and you're not in our area or don't have a physician in this area, you can call that number, and then you can get your Regeneron treatment and talk to them from there. So there's some great things going at Titus, and I'll quote one of our patients who quoted in the article last week, great things in a little old Titus County. So we're excited about that. There's just a picture of the infusion centers that we have that, and that will be on our website. A lot of questions this week about the third shot and the booster shot. We are giving the third shot. If you meet one of the criteria with cancer treatment or immune system, please go see our vaccine clinic. They're doing the attestation. You're able to get your third shot at this point. I would encourage you to work with your primary care doctor as well and make sure they're in the loop of getting you that third shot. A lot of questions this week about the booster. The booster's coming. It has not been authorized yet by the correct authorities, so we're waiting to see what's going to happen on that. We expect a booster to be available in September, and Titus Regional Medical Center will do everything possible to ensure we're giving that out on a consistent basis, on a daily basis, and we'll expand our clinic if we need to get everyone taken care of. I want to encourage everybody at the vaccine of East Texas. It is the Titus Medical Plaza now. Seen some changes this week. And, I've seen a lot of people that we know in this area are losing some friends to COVID. And some people who shouldn't be dying at the age that they're dying have passed away recently. And I've seen some people who've got the vaccine this week who've been against the vaccine from day one. But they're seeing the value and they're getting concerned about what's going on. Again, I will encourage you to get the vaccine. I received both my first and second dose, and if the third dose is recommended and approved, I will get my third dose as well. It's just a little thing that I can do to help protect myself and my family and the patients here in Northeast Texas. But I would encourage you to visit our vaccination center and get your vaccine. Our numbers continue to go up, and we'll continue to work on things to improve those numbers on a daily basis. We also want to thank at this time our friends at All American Testing. They did open up a testing center here on 20th Street. They are not associated with the hospital, but they're using our property this week. I just walked by it a few minutes ago, and they had 2 lines of cars, 4 deep. Our family care center on the south side of town has seen numbers over the last 3 weeks they've never seen. So our outpatient physician practices are getting backed up. So we were excited when All American Testing came back to this area to open up this testing center. It is free. You do not have to pay for it. They'll take your insurance card, your identification issues, information, and they'll put that in there. Would encourage you to go online to allamericantesting.com and register before you go. It speeds up the process. But we do appreciate the team over there and the work that they're doing in the hot sun this week to get testing for Northeast Texas. Again, I want to finish today. We're still at that point where we're as much as we can give. We're holding patients from the ICU in our emergency department. We're working closely to try and figure out ways to open up more beds. As we get more staff from the state, it's been slower than we would hope. But we are looking at an opportunity to get more staff. We will open up more beds, but at this time we're sitting at our max capacity like the other hospitals. So I would encourage you to wear your mask, to get your vaccination, wash your hands, social distance. Those are the types of things that you can do that will mitigate the spread in Northeast Texas. Again, we thank you for your support. God bless.